Alrighty. We all have strenuous activities at some point in our life. Unfortunately, some of those strenuous activities can catch up with us. For me, it was summers working doing construction, demolition, and concrete work. Intense water polo and constantly lifting in the gym that left me doing the Bugs Bunny line. Hey, what's up, dog? No. Dog one first, please. Yeah. A few weeks later, I found myself in the hospital recovering after surgery, curled up in a ball, confused, and in the worst pain of my life. Today, I'd like to enlighten you on the subject of hernias. Being someone who has had bilateral hernia surgery and done some thorough research, I believe I can shed some light on this subject. Guys, if you've ever gotten a physical, you've had the line, drop your pants, turn your head, and cough. But girls, don't think you're free from this subject. It isn't. This isn't the only reason, but if you ever plan on having kids, listen up. Today I'll be reviewing what a hernia is, a few types, the causes and symptoms, and the possible medical treatments to fix them. For those who aren't exactly familiar with what a hernia is, let's first start by learning some of the basics. I'll leave it on that first one. The best way I've heard this described is think of an old tire and think of the inner tube popping through the wall of the tire, and that's basically summarization. And as I go through these, kind of keep that picture in your mind, and also the mental picture of the tire with the thing popping through. A hernia occurs when the contents of a body cavity bulge out of the area where they are normally contained. These contents, usually portions of the intestine or abdominal fatty tissue, are enclosed in the thin membrane that naturally lines the inside of the cavity. According to the National Center for Health Statistics, about 5 million Americans are living with an abdominal hernia. First hernia I'd like to talk about is the inguinal. And inguinal hernia most often occurs when a portion of the intestines protrudes through the lower abdominal wall, which is in the groin area, as you can see. This is the most common type of hernia, occurring or taking up about 75% of all the hernias that happen, affecting about 2% of American men. This type of hernia can also occur in women, though less often. A direct inguinal hernia creates a bulge in the groin area, and an indirect hernia descends into the scrotum in men or to the outer folds of the vagina in women, according to the American Medical Association. Second type of hernia I'd like to talk about is the umbilical hernia. These common hernias are about 10 to 30%, and are often noted at birth as a protrusion at the belly button, or the umbilicus. This is caused when an opening in the abdominal wall, which normally closes at birth, doesn't close properly. If small, this type of hernia usually closes gradually by age 2. But if not, larger hernias and those that do not close by themselves usually require surgery around the ages of 2 to 4. Even if the area is closed at birth, umbilical hernias can appear later in life because the spot may remain a weaker place in the abdominal wall. Third one I'm going to talk about is femoral hernia, and this is the most common one in women. Femoral hernia occurs in the area between the abdomen and the thigh, and appears as a bulge on the upper thigh. It's more common in women than men. It's usually resulting from, usually due to pregnancy. After hearing about these different hernias and seeing some graphic photos, you'll be thinking, alright, so how on earth does this happen? Let's now look at some causes of hernias. It might take a long time for a hernia to develop, or it might develop suddenly. Hernias are caused by a combination of muscle weakness and strain, not only strain as some people might think. Although the cause of the weakness and the type of strain may vary, hernias are actually more common in babies and toddlers, and most teens who are diagnosed with a hernia actually have had a weakness in the abdominal wall. And this is known as a congenital defect when you're born with a weakness due to the development. There's something that doesn't exactly close up right or doesn't heal properly. And so again, to reiterate, it's a muscle weakness with the combination of a strain that generally causes hernias. Umbilical hernias appear in women who are pregnant also due to the given stress built up on the area. Other such stresses are obesity or sudden weight gain, lifting heavy objects, diarrhea or constipation, and persisting coughing or sneezing. So some of these have contributed to, when you have that weakness, they'll just make it a lot easier to get one. And you can go to the videos. Now that you are more familiar with that unusually strange lump that your best friend's always showing you, and just trying to, I don't know, get you freaked out on that weird lump, how are they going to get this fixed? The first video we're going to look at is of a conventional surgery. You can start it, it's pretty quick, so you got to keep with it, which involves an abdominal incision, after which the protruding tissue is either removed or pushed back into the abdomen. So we're still opening it up, getting down to it. And the abdominal wall is repaired and strengthened. The American College of Surgeons says the abdominal wall can be strengthened by sewing surrounding muscles over it, and can be strengthened with a special type of mesh, which is basically interwoven fibers that are able to be in your body, and your muscles can grow into them. The second one we're going to look at this is the laparoscopic, which uses a long metal viewing tube inserted through tiny incisions, and basically the rest of the procedure is basically the same that we see in conventional surgery. We'll get it up in a sec. Those are the 3 incision spots that they use. So they insert the laparoscopics, they fill it with carbon dioxide so that the cavity will expand. That's the viewing tube that they insert through one of the incisions. And the other 2 incisions, they have grabbers or feelers that pull the hernia back through, move it away from the abdominal wall, and then tack on a piece of mesh to prevent the intestine or organ or whatever is going through to go back through. The ACS reports that over 500,000 people undergo hernia surgery each year. Now that we've looked at some of the causes, and we've learned more about hernia, what they are, how they show up, how hernias are treated, you don't have to be as confused if one ever appears. And if you notice a lump, don't procrastinate. See a doctor so you can get some sweet scars to show off. Thank you.
So Matt, what did you think?
I thought he did good. He cited all his evidence. He said where he got it from. He gave credibility to him. He spoke slow, and if you could understand him, the use of the visuals also gave us something that we could relate to, and we could see how the intestine is going through the wall. One fault was definitely the transition of the videos on YouTube. We just had those prepared better.